Good evening to you, and thanks for being here with us. A new government survey finds that 20% of all children in this country have or had flu-like symptoms just this month.
And most of those cases are H1N1. It's getting so bad that pediatricians say their offices are packed, and they're working long hours trying to treat all the sick children. Sherelle Roberts joins us now with more on H1N1's impact on children in tonight's top story. Good evening, Sherelle.
Good evening, Sam. Well, the CDC warned us months ago that this was going to be a hard flu season, but now we're getting to see exactly what that means, especially when it comes to children. The H1N1 virus is hitting kids harder than anybody else in the nation. Doctors' offices around the country are swamped with sick little ones. In fact, health officials are now saying that 1 in 5 kids did have or does have flu-like symptoms this month. Pediatrician Katrina Hood is not surprised.
So many kids, and basically anybody born after 1957, we're all at risk for catching it.
Her Lexington office has been packed with sick kids. Some nights she works long after sunset treating the children. She says many are getting sick in school.
All it takes is one in the class, do a little coughing, and then all the kids in that classroom are pretty much possibly going to come down with it.
The doctor believes the flu cases she's seeing are H1N1, but she's optimistic that this virus is not proving to be as dangerous as many thought it would be.
The vast majority of the kids that are coming in with H1N1 are really very mildly affected. So low-grade temperatures, cough, congestion, not feeling great, but certainly not really bad.
In fact, Dr. Hood is saying that if your child is having flu-like symptoms, you might consider skipping the doctor's visit unless they're dehydrated or having respiratory symptoms.
Because flu is a respiratory illness. So if you don't have the respiratory symptoms, it's likely not flu. A little bit of Motrin, lots of rest, fluids, those things are going to help. So we couldn't see every kid with flu, or we'd probably be here 24 hours a day.
And kids aren't the only ones being hit hard by the flu. Nationwide, 7% of adults who were surveyed said that in the past week alone, they've had flu-like symptoms. Live in Lexington, Sherelle Roberts, WKYT, 27 News First.
And those sick children have a lot of company. 2 more school districts have shut their doors because of illness. Jackson County Schools